The real challenges with dementia care is just the volume of patients who are going to be diagnosed and are diagnosed with dementia around the world. It's a global problem, and we really don't have any effective therapies so far for dementia. Part of that has been not knowing the cause of the disease and the processes. This was just all lumped into one topic, dementia. But I suppose we're learning a little bit more that there are set proteins linked with different forms of dementia, amyloid associated with Alzheimer's disease, alpha-synuclein with Parkinson's dementia, TDP43 with frontotemporal dementia. So by knowing the actual root cause, we can come up with directed therapies. And we're just starting to see that now in the clinic, monoclonal antibodies directed against the specific protein. We also know that lifestyle is critically important, so regardless of the form of dementia, looking at vascular risk factors, controlling blood pressure, treating cholesterol, looking after your body mass index, regular exercise, these are all critical parts of managing patients with dementia. Separately, we need to work out a whole workforce capacity. So we don't have enough trained nurses, allied health care. It's probably not appropriate just to be putting patients into, dementia homes. We really need to try and manage them independently, ideally in their own home environment with appropriate services and care for patients. I think there's a real deficiency in education in the community towards conditions such as dementia, and not all communities are the same. I come from the Western Pacific, which is really the largest populous area in the world. Accounts for 3/5 of the world population, and even in that one region there's huge differences in financial circumstances. We have developed countries like Japan, Korea, Australia, less developed countries such as Vietnam, Thailand, Laos and China, and I think that we really need, it behoves us all to educate the community firstly what the conditions are, and the most common form of dementia in the community is actually vascular dementia, and to get on top of vascular dementia it's a matter of actually understanding vascular risk factors. Fortunately, in developed countries, people don't smoke very much anymore, but in poorly developed countries, smoking is rife. There's still TV ads for the Marlboro Man on, Philippines TV. So it's part of an educational program. Separately, understanding the importance of high blood pressure, treating blood pressure, preventative approaches. These are what I think we really need to focus on as a global community, linking the Western Pacific with Europe and the United States, North America, to really have a cohesive group moving forward.